Yeah.
Have you ever had a client speak about it in almost like a boastful manner?
Yes. Yeah. So, and so this part of so before break, that's kind of this is where I might push some buttons a little bit. So I was talking to Stephanie about this, and just because I have the clicker does not mean I am always right. And so this is I guess, constructivist, everybody sharing and so so one of my experiences, so I told you that I interviewed people 12 to 18 on their experiences with self-injury. And one of the questions was, is there ever a time in your life that you can see not doing this? And I had one person who was, I believe she was either 17 or 18. She was a senior in high school, and she said, nope, I do this. This is what I do. Why does everybody freak out over this? When I get upset or when I get stressed, I make 6 or 7 cuts on my arm. I clean it up. I'm okay. I don't do drugs. I don't have sex. I have a job. I make A's. I'm going to college. And people panic about this. Why should I stop? It works for me. And I always keep that in my mind because I think, and one of my slides later is, some people may not believe they need to stop. And I always think about, why should somebody stop? And so I've come up with, okay, what are y'all's thoughts on that before? Why should someone stop? Why should? Okay, so because it's healthy, or it's I guess not because it's healthy, because it can be seen as unhealthy. Other things. Any other reason why people should stop? Or is that even a? Yeah.
Develop another coping skill that can be done anywhere.
Okay, so it may be so if you stop this, you could start something else or find something that may be different for you that doesn't involve cutting or scarring. That's right. Yeah.
Well, just that the injury becomes more severe.
Okay, so it could become more severe, and it could be, so there's a big fear about self-injurious behavior, suicidal behavior. Talked about that, could it, what if I'm meeting with somebody and, I might feel this pressure of, they have open cuts. What if this person does commit suicide by an accident, and I didn't do enough, or I didn't take it as serious as possible? Wow, that's on me. And, well, nobody wants that. Well, that feeling of any other. Yeah.
Well, it may stop you from actually dealing with problems.
Okay.
Infection and medical care.
Say that again.
Infection.
Okay, so infection, there's a possibility of infection. There's a possibility of medical care. Okay, yeah.
I have a resident that he's cut a lot.
Yeah.
You can see the redness, and he covers it up as if he's embarrassed.
Okay.
But he isn't, yet I think socially he doesn't like.
There's a lot of judgment that goes along with it. Yeah, sure. Yeah. Okay.
There's sort of it sounds like there's a rigidity about it. I mean, for me, if the person could consider and talk about alternatives,
Yeah.
Why they aren't satisfactory, as opposed to just having the one move that they can do.
Okay, so having a plethora or multiple coping skills that they can try. So they have like a bag of tricks or a tool belt of different things, is that?
What I would just kind of expect from how you describe that there might be some rigidity in other areas.
Oh, yeah, okay.
That I do things my way.
Yes, yeah.
I don't consider alternatives.
Yeah, oh yeah, that's a good point. That, hey, this works for me, this is what I do. Hey, I'm doing this. Don't try to convince me otherwise. Yeah, one of.
I keep thinking that if they feel it's okay to hurt themselves, then isn't it okay to hurt other people?
Okay.
It's hurting.
Okay, possibly. So, in this whole, and I realize, so I'm saying this, and I realize some of you all, if anybody walks out and mad, that's okay. But I'm hurting myself. So, and I talk about this to school counselors all the time about, if you let me, and I'm guessing a lot of, counselors, psychologists in here, social work, LMFT, you talk about your limits to confidentiality. Now, the way that I describe it is if you tell me let me know you're going to hurt yourself, hurt somebody else. So that hurt yourself. What is hurting yourself? Because my idea of what I do to hurt myself, now I think if I take a hammer and slam my hand, that's hurting myself. If I bite my fingernails, then I'm not hurting myself. If I pinch myself, then I'm not hurting myself. If I get a splinter, I'm not hurt. But if I'm working with a client, I always want to make sure that they know my view of hurt, because hurting yourself, that's a real vague term. Yeah, and then,
If that's the idea of hurting themselves, what do you do in the case where they're sharing with other
Okay, sure.
people? Hey, this worked for me, so why don't you start cutting?
yes.
That's like the boundary.
Yes, so the being able to talk about sharing education part of it, the psychoeducation. Yeah, did you have something? Okay, so yeah, the psychoeducation part of it. Yeah, that's very key. Well, that's what I feel strongly about that. Being able to talk about it, setting up as an atmosphere that this is okay to talk about. No matter what you say to me, it's going to be okay. That non-judgment, yeah.
But how do you handle when they want to promote it to someone else that's never tried it?
Okay.
And they may be hurting for other reasons. How
Okay.
do you as a counselor deal with ensuring, or at least trying to get it through this person's head that because it's okay with them, they're going to see, well, it's okay for somebody else to do it, so if you want to talk to me about it, I'll share what I do and you can join me. Well,
Okay.
hard. You know, I mean, I've heard that when kids start doing that.
Sure. That's a great point. So the idea that, hey, I'm doing it and I talk to other people about doing it and, you know, this harmful thing that it's, yeah, that's I'm going to come back to that in just a minute with this whole, because I have a scenario to talk about with y'all. So and we hit on this a little bit, but what do you think about self-injury? Good, good, bad, positive, negative, terrible, stop, go for it, whatever works for you. I hate it, makes me nervous. What do you think?
I think it's an effective, unhealthy coping skill.
Okay, so it's effective, it's unhealthy. Okay, now this is going to sound like a ridiculous question, but what's unhealthy about it? I know it sounds ridiculous. What's unhealthy about it?
And me, the way I explain it is, if you treat yourself this way, you're giving people permission to treat you like that too. So
Okay.
that's what makes it, I think, unhealthy in that you're kind of giving people permission to downgrade you, judge you,
Okay.
you know, be negative towards you because you have scars or you're cutting.
Okay. So if you hurt yourself, then you're giving other people the opportunity, or saying that's okay. Okay, anybody else? Yeah.
I feel like it might help you forget, but it doesn't put you in a good space. It's not like
Okay.
a positive space with it.
Okay.
So there's that line where you can find coping skills and being a positive space. This isn't one of them. This is one. So you're not helping yourself.
Okay. So and now and again, going to sound like a ridiculous question. What's non-helpful about it?
Well, that's dangerous.
Okay, so it's dangerous. Okay, because the possibility of you could really hurt yourself. Yeah. Okay.
I think my coping skill for some people is negative self-talk. You know, they make a mistake or do something wrong and they just, just attack themselves.
Okay.
Negative self-talk. Now that may be a coping skill, but does it really help you in the long run? Does it make you a better person? And I think self-injury is the same way. It may be a coping skill, but does it really help you in the long run?
Okay, so it's this kind of, it's a negative thing. It's not help. Yeah, go ahead.
I think it's unhealthy because it's like a scar, like a mark, and it like reminds you of your shame and guilt, and you look at that and you listen to your shame and guilt.
Okay, so it reminds you of bad times as opposed to something that would remind you of something good. Okay, yeah.
Is there any research that shows there's an increase in severity of injury?
So some of the ways that, so some of the research shows, and some of the way that I've had it explained to me is, because I told you earlier about how does somebody start, that's one of the things that boggles my mind, how somebody, either razor or scissors. Now I understand some people have said, when I ask how you started this, they'll say, well, I was getting so mad and I went and kicked something and then, man, it hurt or it really hurt, but it was kind of like I forgot about it that way. But when, it's very difficult for me to understand this. How do you put a razor, because I think I'm just a weakling, I don't like pain. And so I'm like, no. But the way they explain it to me is, I think, does it hurt? It's like, yeah, the first time I did it, it really hurt. So the pain was like this. And then at the end, there was this relief. And then the next time, so I went through all my stuff. I tried breathing, I tried breathing, I tried, doing yo-yo, and it didn't work, so I tried it again. And then it hurt this much, and then there was this much relief. And then it hurt this much and a lot of relief. So over time, it gets less pain, more relief. And so even trying different activities, if you have this thing, so those of y'all that eat chocolate, you shop, you have a glass of wine, you go jogging, you clean, shower, sing, that sort of thing. Think about if I provided different things to you and it said, here's a stressful situation, here's trying these other things. To a point, you're like, oh, maybe I'll try these out, but it's not working, I'm going back to my thing. And so when that is effective, it almost reinforces that, hey, do this, because it works. But yeah, that sense of that the more you do it, almost I think about, somebody who drinks. Maybe the first time they drink one beer is like, whoo, that's all they can do. And then 3 years later, it's a six-pack. It's that same type of thing that people can have. They can get develop not an immunity to it, but need more to get the same tolerance. Thank you. Yes.
So one thing this makes me think about is the stigma among professionals.
Yes.
Maybe that's part of what you're getting at.
Yes.
And it also makes me think that if you believe in unconscious concepts like masochism, someone can be masochistic and not be aware of it.
Yep.
It would be a great way to masochistically get rejection, even from
Sure.
people that want to help you.
Sure. It's a way to, if I'm going to test you, it's a way to push you away to see how much do you care about me, or I'm going to separate just on purpose because I don't want you to get close. Some of y'all may see that a lot. People that have been hurt in the past, that sabotage their own relationships because they've had a bad relationship in the past, or a couple of them. And so whenever they get into good relationships, it gets to a certain point and it's almost like, I'm going to sabotage this because I know what type of pain there can be and I'm going to stop it before it ever gets close. So how do you respond? And I talk about this a lot, finding the meaning behind the behavior, finding out what it means to that person. What is it like for you? How did you start? Does it hurt? Is it okay if I ask you questions about it? How is it for you to talk about this? Making it okay to talk about, making it okay that it's something that's out there in the open. Talking about, psychoeducation about, I've worked with kids talking about, and sometimes when I do presentations at schools, I get a lot of pushback with school counselors because I'll say, do you talk to them about how to clean their tools? It's like, well, why would you talk about that? Because if you're talking about them cleaning their tools, then aren't you promoting it? Not necessarily. I'd rather talk to somebody who is healthy about it or clean about it than somebody who develops all sorts of infections. Because then it's okay to talk about this stuff. It's okay to, yeah. Jim.
Yeah. You were talking about earlier, would you treat like cutting that type of behavior the way you would another self-injurious behavior, like headbanging, fighting yourself?
So again, I want to know, so my idea, now this is just my point, so in counseling in general, my view is it's voluntary. Now I understand with hospitalizations, it's not voluntary a lot of times, especially for adolescents, it's not voluntary. But my belief is I can't force somebody to change. No matter if I go, change, if someone wants to change, when people come to counseling or seek out mental health services, they want something, and I don't say better or worse, they want something to be different. And this is just I know everybody works in different settings, so this may be more or less applicable to you, but in a private practice setting, somebody comes in because they schedule an appointment because they want something to be different. And my number one job is I want to understand what they want to be different. And then treating that, okay, you want this to be different, and then everybody has their theories. That's part of being a professional. You have a theory of change, how things work, about how you go from headbanging to non-headbanging, biting, trichotillomania, all that. So how do you go from that to not doing that? And that's where you get all these theories in there about, I think somebody mentioned DBT or dialectical behavior therapy, there's cognitive behavior, all these different things about how people believe change occurs. So in how you would treat one versus the other, I think everybody has their own ways of doing it, but understanding what that person wants to be different. And I don't know if that answers your question at all about if you would, you're kind of...
It could be treated the way you would treat other, or ABA.
If it is similar, so somebody who cuts their arm versus somebody who hits their head, if it's the same meaning behind it, if it's I do it as an aggressive act towards myself, then whether I bang my head or whether I kick my foot or whether I cut my arm, it seems like, now I'm just talking about this off the top of my head, but it seems like the same purpose behind it. So if it's a different, one part of the body versus another, it's just one way that they do that. They accomplish that goal.